My name is Dr. Elizabeth McIngvale, Director of the OCD Institute here in Texas. Today, I want to talk for a second about treatment of obsessive-compulsive disorder. What we know is that there are lots of different treatment options and lots of different treatment frequencies that individuals can choose from. And so what I mean by that is that there's both a specific treatment model you can choose from when you're thinking about OCD treatment, and then there's, of course, the way that it's implemented or the frequency in which you receive that treatment. And so here at OCDI Texas, we offer kind of the most intensive treatment options. We have a residential program for obsessive-compulsive disorder and anxiety disorders, as well as a day program, also known as a PHP program, a partial hospitalization program. Other treatment types are, treatments like outpatient therapy, self-help, and lots of different options in between. What we know when it comes to the type of treatment is that while there are different modalities of treatment that individuals can choose from, the most effective and the treatment that has the most research and evidence behind it is called exposure with response prevention, also known as ERP. ERP is a treatment model for OCD that has been studied for decades, has amazing outcomes, and can help get individuals to a place where they are free from their OCD, where they no longer live a life where OCD makes decisions for them, but instead they get to make decisions for themselves. And that certainly is our goal here at OCDI Texas. So what is ERP? ERP is exposure with response prevention, and it's similar to what it sounds like, right? Our goal is to think a lot about what are the things you're no longer doing because of your OCD? What are the things you avoid? And how can we get you to re-engage with those things, with those values-based activities that you want to be doing, but you no longer are because of your illness? And then we slowly have you do those things, but have you no longer do your rituals or your compulsions that you've previously been engaging in. Because what we know is that those compulsions keep the OCD cycle alive. They keep that fear alive, and we really want to change that relationship with anxiety and OCD. What I'll say about ERP is that many times people think ERP is this really scary treatment intervention and that we're going to force people or push people to do things they don't want to do. And that is actually quite opposite from the truth. ERP should be freedom-seeking in the sense that it should align with your values. It should make sense. And it should be something that, yes, while it will be challenging, it should be something you really want to do, that you're really excited to do because you know the opportunities it's going to open up again for you in your life that OCD has closed off. So ERP should always be values-based. And here at OCDI Texas, yes, our primary treatment intervention is exposure and response prevention, but of course we also add in lots of different modalities, whether that's, incorporating acceptance and commitment therapy, dialectical and behavioral therapy, or other interventions like CBT for depression or for general anxiety that individuals need. That is where that individualized custom approach is so critical when it comes to the treatment that you receive. Across the board, what we know is ERP is the most effective intervention for OCD. And no matter what, that is the treatment you definitely want to be getting, at least to start. It should be your first tried treatment because, again, it is the most proven.